Hello, I'm Sama Kandil and welcome to ThePrint. In a response to a question in Parliament, the Union Ministry of Health and Family Welfare has said that 6 major central government hospitals in Delhi recorded a staggering 2 lakh cases of acute respiratory illnesses, or ARI, between 2022 and 2024. And here's what makes it even more alarming. About 30,000 of these patients, nearly 15%, had to be hospitalized. This data was shared by Minister of State for Health Pratap Rao Jadhav in response to a question from Rajya Sabha MP Dr. Vikramjit Singh Sani, who asked whether rising air pollution in cities like Delhi is directly increasing respiratory diseases and whether the government has studied this trend. The answer mentioned that air pollution is one of the triggering factors for respiratory ailments and associated diseases. There is no conclusive data available in the country to establish direct correlation of death, disease exclusively due to air pollution. Health effects of air pollution are synergistic manifestation of factors which include food habits, occupational habits, socioeconomic status, medical history, immunity, heredity, etc. of individuals. But even though the government says pollution is just one of the triggers, data from hospitals, research studies, and disease surveillance networks all point in the same direction: how toxic air is harming people, deeply, consistently, and in large numbers. Let me break down the year-wise data for you. In 2022, Delhi's 6 big government hospitals saw about 67,000 emergency respiratory cases, with almost 10,000 patients needing admission. In 2023, the number rose slightly to almost 69,000 emergency cases, with 9,700 hospitalizations. In 2024, something significant happened. Emergency numbers dipped marginally to 68,000, but admissions jumped to almost 11,000. So even though fewer people came in, more people were sick enough to need hospital care. This suggests that pollution-linked respiratory cases may be getting even more severe, and the scientific community has been confirming this pattern. According to a multi-city ICMR study, there is a clear relationship between pollution spikes and increased emergency room visits for respiratory problems. The study analyzed over 33,000 patients, and the trend was consistent. Whenever pollution shot up, respiratory complaints surged. Meanwhile, the National Center for Disease Control has been using the Integrated Health Information Platform to track pollution-related illnesses since August 2023. Today, it covers over 230 Sentinel surveillance sites across 30 states and union territories, including 6 in Delhi. Every year, the Health Ministry issues advisories under the National Programme on Climate Change and Human Health, asking states to prepare hospitals, stock essential medicines, train medical staff to handle respiratory surges, and raise public awareness when AQI turns poor or severe. Thank you for watching. For more such content, follow ThePrint.